Adults and children need to eat 5 servings of fruits and vegetables. Reference Greater Rochester Health Foundation, no date. Children should spend no more than 2 hours watching TV, playing video games, or surfing the net while getting at least 1 hour of active play while making sure they drink no sugar sweetened beverages. Reference Greater Rochester Health Foundation, no date. Additionally, this program expresses the importance of play and being active along with Shop Smart Tips, providing list basics of healthy foods for parents. Reference Greater Rochester Health Foundation, no date. This program in Rochester, New York was started to inform children, parents, and educators on foundations of a healthy lifestyle. Reference Greater Rochester Health Foundation, no date. Information can be found on local media, television, and radio, pediatrician offices, and child care centers. Reference Greater Rochester Health Foundation, no date. In addition, electronic newsletters are available through their websites. Reference Greater Rochester Health Foundation, no date. In an effort to reduce the risk behaviors associated with heart disease, New York has developed public health policies to decrease the frequency and accessibility to health-damaging products and encourage healthy behavior through policy. Smoking is a major risk factor for cardiovascular disease. The American Heart Association has long advocated for strong public health measures that will reduce the risk of tobacco products in the United States and limit exposure to secondhand smoke. Reference AMA, no date. The policies prioritized by the association and its national partners include adequate funding for tobacco cessation and preventative programs, comprehensive smoke-free air laws, taxation of tobacco products, and FDA regulation of tobacco. Reference AMA, no date. Working with the education and research of the American Heart Association, New York banned smoking in public areas and has increased their tax on tobacco products to the highest in the nation. Reference Busco, 2013. This action decreased smoking over 20% from 2002 to 2012, which is estimated to about 300,000 smokers and saving close to 1,500 lives. Reference Busco, 2013. Obesity is another risk factor associated with heart disease. It is estimated that almost 60% of New York City is obese. Reference Busco, 2013. In an effort to reduce availability of poor food choices, New York Board of Health chose to restrict the use of artificial trans fat in nearly 25,000 restaurants, and in 2008 required that calorie content be posted. Reference Busco, 2013. This does not sound like much, but this small effort resulted in close to 15% of individuals reading this information and eating at least 100 fewer calories. Reference Busco, 2013. The Board of Health has also campaigned to ban or greatly reduce the amount of sugar drinks available, along with reducing the sodium content of food. Reference Busco, 2013. A 64-ounce cola is around 800 calories and the equivalent of a 50 packet of sugar. Reference Busco, 2013. These are empty calories with no nutritional value and increasing the chance for weight gain and obesity. New York City and over 90 other cities and states have joined the National Salt Reduction Initiative to lower the amount of sodium in packaged and processed foods. Reference Busco, 2013. Already, Kraft and Heinz have responded by meeting voluntary sodium reduction targets for some of their products. Reference Busco, 2013. These small steps have begun to improve the quality of food and allowing New Yorkers to make more informed choices, which is slowly making them healthier. To increase physical activity in young people, Schools have implemented standards for physical activity and physical education. Evidence shows that physical education fosters lifelong wellness and reduces risk for obesity, chronic disease, abnormal cholesterol, hypertension, and heart disease. Reference heart.org, 2012. American Cancer Society, Cancer Action Network, ACS-CAN, the American Diabetes Association, ADA, and the American Heart Association, AHA, all promote frequent and quality physical education in schools. Reference heart.org, 2012. Physical education needs to have students participate in health-promoting physical activities for at least half of class period, and the other portion teach them knowledge and skills necessary for lifelong physical activity. Reference heart.org, 2013. The New York Department of Health needs to put new preventative policies and procedures in place focusing on heart disease in non-Hispanic African American communities. The one way to address the issue is to focus on the socio-demographic characters of these communities. The inequalities of racial, ethnic minorities, and low-income families play major roles in contributing to the increase of heart disease in these communities. So access to quality health care services should be a barrier to receiving adequate treatment for chronic illness. To move ahead in this area will require the promotion of universal health care and insurance. The health department can advocate at state and federal levels to make improvements to reform the insurance payment policy in order to reward prevention. This solution has already been implemented in the Health eHearts Pay for Performance program that rewards practices for every patient who meets a high standard of heart health, such as hypertensive patients who have their blood pressure controlled. Reference Summers et al., 2012. The second policy is to promote physical activity and healthy eating in low-income urban neighborhoods with cooperation for other local organizations. The majority of these communities are surrounded by small supermarkets and fast food restaurants that lack fresh produce or healthy foods, but have an overwhelming supply of unhealthy foods high in sugars and fats. Reference NYC, 2009. Also, in these impoverished neighborhoods, there aren't many resources to access to physical activities, such as safe and clean parks and recreational centers. The New York Health Department needs to monitor unhealthy food situation by working with food industry leaders, public agencies, and health organizations to continue regulating the use of trans fat and salt content in food servings in restaurants in these areas. To promote physical activities within the communities, the New York Department of Health can join with the Department of Health and Recreations and the Department of Public Transportation to ensure all members from these communities have access to safe places near their homes to be physically active. Reference NYC Health, 2009. Another possible policy implementation is distributing weekly or monthly news publications focusing on healthy education and informing the public on heart disease prevention and treatment methods, recreational and fitness events that help promote heart disease prevention, and how universal health insurance can assist those who cannot afford quality health care with these communities. Not everyone is proficient in online research and/or has access to online publications. Public libraries or media centers would be great avenues to distribute these resources. This will require the collaboration of the New York Department of City Planning along with the Department of Health. The stakeholders that can assist with these new policy developments will be the Department of Health and Department of Health and Mental Hygiene, DHMH, for its services to conduct community-based surveys through the New York City Health and Nutrition Examination Survey. NYC Haynes. This organization is responsible for collecting data for indicators in the City of New York for people suffering from chronic illness such as heart disease, diabetes, cancer, HIV and AIDS, and mental disorders. The Department of Parks and Recreations is responsible for public access to recreational and fitness events within the city. Reference NYC Parks, 2014. The American Heart Association can work in conjunction with the Department of Health and Recreations because its key purpose is to promote health free from cardiovascular diseases. Reference American Heart Association, 2014. The Department of City Planning, DCP, is responsible for promoting strategic growth, transit-oriented development, and sustainable communities in the city, in part by initiating comprehensive, consensus-based planning and zoning changes for individual neighborhoods and business districts, as well as establishing policies and zoning regulations applicable citywide. Reference NYC Planning, 2014. In order to move forward with promoting any form of policies, a partnership is required with community leaders in the DCP before implementing any new developments.